Hey, welcome back, everybody. Dr. Greg Eckel and What the Health. Today's topic is hormones and their impact on neurodegeneration, brain health, and longevity. My guest is Dr. Dan Kellams. He's at the staff and leader of Peak Vitality out of Denver, Colorado, and he's dedicated to helping patients with chronic health conditions. He specializes in and embraces a functional, holistic health approach and often helps patients in the Denver area and around the country with autoimmunity and chronic health disorders live longer, happier lives with longevity care. In addition, he helps patients maintain optimal hormone levels and improve their reproductive health. Welcome aboard, Dr. Dan.
Happy to be here. It's good to see you.
Hey, I am really excited. We both are educators for a functional medicine group called Go Wellness, and you have been the blood work guru for over a decade. And before we got in the air, you're talking about your just kind of reinvigoration with hormones and how that fits into the healthcare puzzle here. And so I'm really excited about this because I always learn new things from Dr. Dan. So that said, no pressure.
All right.
But let's talk about, hormones. There's been a lot of discussion about bioidentical hormones, hormones in general. I can't believe there's still controversy around hormone therapy. And let's talk about it in brain health and longevity components, what you're finding, what you're seeing, maybe how you measure these things.
Yeah, absolutely. It's interesting. I think what really drove we were, in our conversation, we're talking about, where we've started to shift focus and looking at these hormones, from, the beginning of life to the end. And what was surprising, the importance of brain health and, especially with that aging brain. And we were really honing in on its impact on mitochondrial function, right? But the depth of our knowledge on it, we started to expand that because there was some really good research that when you're an infant, like day one, when you're born, a lot of infants will actually have higher levels of sex hormones in their brain than their adult counterparts. And so it's like the formation and the specialization of these neurological tissues are so critically reliant upon healthy sex hormone levels. And you actually, they say you kind of go through like an infant pause, because right after birth those levels then drop back off until puberty. But yeah, I think if we honed in on mitochondrial specific, because that, it's like if we're talking about the aging process or any health conditions, and I know in your world you really focus in on, like, if you have enough energy, if something has enough energy, there's some really massive changes that can be made. But you take a person who is in a bioenergetic deficiency or crisis, and it's like, okay, now you got a case where it's really hard to get turned around if you can't get those energy levels optimized. And that's where there's a huge role to be played by the steroid and sex hormones on mitochondrial health. And that's where we really started to hone in. I think one of the first impacts that we saw was looking at the fast impact that a massive drop in estrogen can have on neurodegeneration and psychosis in females. And so it's like, okay, well, what is that mechanism? Like, why is that so important? So the enzyme, that PGC1 alpha that we see on a C and exercise and fasting and cold therapy is massively activated via estrogen. So estradiol drives that. And so the estrogen has a huge kick in activating mitogenesis. And where on testosterone can have a kick on that as well, but usually through those nuclear related factor pathways, right? So we get that pro-oxidative trigger that drives mitochondrial health. And they did a really in-depth study on cardiac mitochondria, and they were looking at these specifically. They found testosterone actually improves the crystalline inside the mitochondria. So structurally, you're going to be able to create more mitochondria, have healthier mitochondria, and then all of the sex hormones, estrogen, progesterone, and testosterone, offset the oxidative stress in the electron transport chain. So when we're just talking about bioenergetics, you can't have that discussion without considering the role of these sex hormones and how to keep those optimized. So
Interesting. Yeah. So let's paint that kind of the meta picture there. So with really looking at the sex hormones, steroid hormones, interchangeable, those terms, with their antioxidant and mitochondrial protection role. And just for the lay listener, mitochondria, why are they important and what happens to them as we age?
yeah, so mitochondria, that everybody says, when you say what's mitochondria, if anybody's heard anything, they'll say it's the powerhouse of the cell, right?
Yeah.
And they have a lot of roles, storing calcium, triggering apoptosis. They regulate a lot of our aging process, but it's also where the sex hormones are made. But the biggest thing is their activation and creation of ATP. That's our energy. And they take those substrates, our glucose and our fats, and only in special cases will take protein, but they'll take glucose and fats, and they turn those into the energy that our body requires, every cell. And to give you an example, if you think about, if you ask the question, which tissues never get a chance to take a break, and you think, okay, heart, brain, lungs, and liver, these things are constantly working. They have the highest mitochondrial density. We have lots of it in the prefrontal cortex and the frontal area of the brain. So one, you have to have these to make energy, and in the tissues that require the most energy, that's where you find the highest density. And they say it can make they make up like 10 to 15% of your body weight. And that's how important these things are. But that's where we get all of our energy. We think, okay, we eat food. How does that make energy? What's the mitochondria? And it's creation of this ATP. So one, that's where we get all of our energy. As we age, free radicals, nutrient deficiencies, stress on our bodies, we get this age-related decline, right? And so these things are constantly going through a recycling process where they're renewing themselves. And, so you age a little bit slower and better, the less oxidative stress you have, the less stress you have in general, the better your micronutrient intake is, and all the other hormones, like stabilizing this blood sugar and glucose levels, and keeping like thyroid healthy. And I think, some of the early presentations I actually learned from you was the role of like all these things that impact, like in early studies on the neurodegeneration. And it's like, you got to have your hormones, these tropic factors, and regulating that blood sugar and offsetting inflammation to maintain a really healthy brain. And so energy is required for all those things to work. And then we get this age-related decline of those things. And so the harder you live and the faster you live, the faster you get that decline. But it's really the free radical damage that accumulates in our bodies at our age that really damage those mitochondria. And if we're not doing things to keep them healthy, of course, we age faster, and we are more prone to all these chronic disease and illness.
Are there specific ways that you are measuring that, or certain patterns that you're seeing with your patients?
Yeah, I mean, I'll tell you, honestly, the biggest thing, Dr. Eckel, that we see that's a good indication of mitochondrial health is a in-office neurological exam, where we find like when that brain fatigues really fast. Because if there is a neurological or mitochondrial issue, you're going to see it typically in the brain first or in the gut. And when you're having someone do like little exercises like finger tapping, and they quickly fatigue out and start messing up, or you're having them change different things, whatever it is, you'll see a fatigue hit. A lot of times we'll see it in certain behaviors, like maybe it's reading or just standing, listening to music. Whatever area of the brain seems to be the most impacted, you'll see the neuronal fatiguing in that area first. And that is one of our biggest and simplest indicators that there is a decline in total mitochondrial health. And it's really going to show through neurological situations. That's why I was so excited to talk to you, because I know, with everything that you've been doing and the amazing work and the outcomes you get with people, I know it's like I'm sure you see that.
Yeah, there's there is a new kid on the block. It's called Me Screen. Hamel Patel out of UCSD. I'm going to share it with our network when it's ready for prime time. But I know that you're going to love it because it is a mitochondria test, one of the best ones that
Wow.
I've seen out there, and it measures 4 succinct areas, and one of them being reactive oxidative species on the mitochondria. And, I think we'll just try to say mitochondria as many times as we can during this podcast. But it is that important. And looking at all chronic illness, when it comes down to that energy factory, these are really dynamic organelles. And I think, and you had mentioned then the next step of the process from that kidney bean shaped organelle of the mitochondria goes creating ATP, then it goes through that electron chain transport. And there's a lot of research coming out. We're going to see a lot of people talking about that next step is going to be it's the next horizon of research that's coming out. So, we are living at an amazing time. I still, there's so much to kind of push in on and explore. But in the real world, it really matters. Are we moving the needle for our patients? And so maybe you want to share some stories of folks where you did some optimization of their hormones and you found some really great breakthroughs for them.
Yeah, absolutely. And to touch back on one of the other tests that we find is a really good breakdown of the mitochondrial components and the organic acids is the metabolomics test. That's really great because you get to see, the Krebs cycle production. You get to see the electron transport chain production. You also get to see the metabolites being produced by utilization of the fatty acids and the glucose. So that's have you done that one? That's a
Yeah.
great picture. I'm really interested in the Me Screen, but that metabolomics is a great picture. We'll pull that in when we need to narrow things down. But when we started to look at hormone optimization, first like your master hormones, like regulating the cortisol, getting the adrenals healthy, really stabilizing the thyroid. And then, one of the things that I think is super surprising in a lot of the people that we find that have some really low hormone and low energy is their iron status is just horrible, right? And you're like, okay. And I know with aging, we tend to see some people and women, I think we see quite a bit of accumulation of excess iron. But if that iron status is not balanced, that's a really key piece. So, as far as like some of the outcomes, what's incredible, and this is where the fertility, really made a massive change is, the highest density of mitochondria you're going to find between males and females is actually going to be in the ovaries. So it takes so much energy to create a spark of life, right? And that makes sense. Like, okay, how much energy do you need to create a human being? A lot, actually. And so, you got to have all this mitochondria there. So, when one of the key principles behind our fertility program has been optimize energetic output and these bioenergetics. So, when we start working on these things, we have to optimize these hormones, and that's been a key piece is identifying. We can do that a lot of different ways, but when we do our initial labs, I love the Dutch test, and we'll look at some of these markers in the blood. The Dutch test, we're gonna get a all of the hormone pathways. So then you can identify in there where those hormones are off. And what's interesting is when you optimize those chains, you start to see a turnaround in someone's energy levels. And that's why a lot of times, you know, the quick fix is to put someone on bioidentical hormones. And what happens? Energy turns on, they start getting that drive, that perseverance, you know, to get in there and do the work. Motivation increases, libido increases, but the amount of hormone receptors in brain and neurological tissue really are incredible when you see that, because people start to feel like they're themselves again, and it clears brain fog very quickly. And so that's something that we see consistently across the board, regardless of how you're going about optimizing those hormones. Once you get them to where they need to be, you'll find a person say, I feel like myself again.
Cool. That's
Yeah.
really awesome.
Yeah, it's been incredible. And you know, there's a lot of natural ways. I think a lot of people are looking for, you know, like this one pill. Like I hear a lot about the Tonga Ali and
Yeah.
these things to optimize testosterone. But the reason it's low, or the reason the estrogens are low, is you want the big picture. You know, and you and I are pretty similar in our efforts to get down to root cause and look at the labs and say, okay,
Yes.
you know, when someone says I have low testosterone, the question is, well, why? Or you know, if you're low energy, like what do I take for low energy? Well, you tell me why you have it, and I'll
Yes.
tell you what you need to take, right?
Yeah. Everybody wants to know, well, what can I take? And it's like, well, it's a different path to get there. It's the why that really matters. And in that assessment, so in that endocrine triangle that you've been talking about, the adrenal glands and then the steroid sex hormones, estrogen, progesterone, testosterone, thyroid is up there. What are you seeing thyroid's function with brain health, glial health in particular?
Yeah, so you know, there's some really good research both on hypo and hyperthyroidism. And what's interesting is in hypothyroid states, glial cells, they have to be attenuated by healthy thyroid. And if you have low T3 specifically, you tend to see that those glial cells, they start leaching out inflammatory cytokines. So one, that's a big piece on the neurodegenerative side. The next thing is, and it's so multifactorial when it comes to thyroid. One day I sat and I thought, well, how many different mechanisms specific to thyroid are going to disrupt brain health? And so we go, okay, low T3, we have this glial cell disruption, and we get a pro-inflammatory state. The next thing is you start seeing structural deterioration in your neurons and your astrocytes, because that thyroid hormone is necessary for the reparative drive and its metabolic feature, right? So if the thyroid regulates metabolism and the activity or the ability for these cells to be turned on, well, you have to keep that turned on to maintain healthy repair and clearance of out of the brain, and keeping that also that blood-brain barrier integrity in place. So the lymphatic system can work properly. And so so you got a metabolic feature, you got energetics just in general, because thyroid hormone has two really specific receptors inside mitochondria. So we have ATP production, we have just metabolic features of activity of reparative processes and clearing out that all that toxin and accumulation in the brain. And then we're going to see this glial activity not being properly attenuated due to a low thyroid state. So those were three really massive mechanisms that we see there. So I think those are huge. And then how the gut has an impact and the thyroid's role in gut health. And so you get down regulation in the gut and the mitochondria in the gut, because the thyroid, well, now some of these neuropeptides like VIP and BDNF, and then also again not having gonadotropin releasing hormone in the gonads producing and the adrenals producing these sex hormones, to then have those available for neurological tissues is crazy. So it's like this crazy spider web. It's like, okay, once it's
Right.
off, that's not good, right?
You know, it really speaks to the matter of when you have neurodegeneration, and only going to a neurologist who is not looking at any of that. They're really missing the boat in that, of course, it's all connected and one entity. And that's what I love about the functional integrative approach is that it really puts it's a systems approach. It puts all of it together. And you see, I mean, we start talking about the thyroid and you're like, well, it's integral in the gut and the gut connection with the thyroid, which then has the brain connection. And so you have all of these regulatory components feeding feedback loops where you can't just address the neuron, right? I mean, and then if we take it one step further back of like, okay, well, how do we prime for the hormones, right? I know you wanted to talk about that today too, around the omega-3s, omega fatty acids, and how important those are in this discussion of hormone production in brain health, etc. So I'm just going to lob that to you, Dan.
Yeah, and one of the things that popped into mind that we hadn't even talked about was the role of thyroid and these hormones and how they also regulate specific aspects of the immune system, right?
Yeah.
And that's a whole other component on this. And so like to your point of go to an endocrinologist, they're not looking at what the immune system's doing. You go to a rheumatologist, they're not looking at what the hormones are doing. And then the neurologist certainly is not. It's so broken. I remember one of the first conversations I had with you when you wrote your first book, Shake It Off, and I was like, what are you doing? You're like, I'm looking at everything, right? And you were. I was like, oh my gosh, right? That was a dumb question. I should have known that was the answer, right? So that was so exciting. But yeah, so when we take that step back, first we want to get an assessment, and you almost you have to take this from a priority standpoint. You say, okay, we know these things are disrupted. How do we first start to optimize these? Now, from a generic endocrinology standpoint, from a functional, perspective, one thing you want to do is make sure that a person doesn't have any massive micronutrient deficiencies, right? I mean, that's a critical piece because these are precursors. One, they're building blocks for all of our tissues, our proteins, and and our carb, the carbohydrate intake that we need to create some energy. So micro and macronutrients are so critical. And then we don't just need these for building blocks, but we need these cofactors and enzymes in order to make hormones and make tissue. And that's still a critical piece. And that's where like omega fatty acids and vitamin D status are so incredibly important. And people can get some lab measurable increases in their sex hormone levels just by adding those back into their diet if they are in fact deficient, or and our level of deficiency is way different than that 30 to 100 on the vitamin D scale.
Right.
I like it on the upper limit, 75 to 80. And we had in really to talk about how important that is. We know vitamin D has a massive impact on brain health. I've had this has happened multiple times. We'll have somebody come in for infertility and they don't feel good, and we'll run their labs, and we'll see these micronutrient deficiencies. The top ones we see are D and zinc. And you get them started on that, and you'll see them turn around. They've called. This has happened multiple times where we'll get a call and like, what, I really wanted to work with you guys, but I took the supplements you told me I was lost in or lacking, and I'm pregnant. I'm like, oh, well, okay, well, that's what you needed. Clearly, that was important. And so it's so important. If it's needed to spark a life, it's definitely needed to keep a life going, right? So
yeah. I'm curious on that front. Have you tuned into the Copper Cure with Morley Robbins at all, and copper's role with the vitamin D and the zinc and those ratios? It's okay. I'm throwing you a curveball live.
No, I'm always. That's why I said at the beginning of this. I'm going to learn something today too. So, you said that it's called the Copper Cure.
Copper Cure.
Copper Cure. Okay.
basically, it's called, Cure Your Fatigue, how balancing 3 minerals and 1 protein is the solution that you're looking for. Well, I'll have him on here, Morley Robbins. He's opinionated, but also has some great research, and it kind of ties into some of these discussions around micronutrients and balancing the hormones. So it's a fascinating, maybe a little controversial read, but well worth our attention, I'll just say. I'll
Well,
just leave it at that. Yeah.
yeah. Well, and clearly, if it's worked for some people and enough where someone said, "Hey, I'm seeing this consistently enough, that I'm
Yeah.
going to write a book about it," right?
Right. Yeah. So let's talk about the omega fatty acids and why are they important to measure and how does that fit into this conversation?
Yeah, so one massive anti-inflammatory pathways, right? So your EPA, your DHA, and we know that those are really important specifically for cardiovascular tissue and brain health, but it's massively, massively anti-inflammatory. And on that, one of the key features when it comes to hormones is the prostaglandin pathway, the PG3, prostaglandin 3 pathway requires omega fatty acids, and most of us are depleted. And so that is a primer for every hormone receptor and hormone function. So you can really improve the pituitary output of the gonadotropin releasing hormone. You start to see better improvements in production and utilization of the sex hormones, the estrogen, progesterone, testosterone. So really, with the anti-inflammatory role and the primer in improving these receptor sites with the role of its the prostaglandin 3 pathway, that is such a critical piece that a lot of times overlooked. So that could almost be its own segment of saying, hey, from a functional perspective, got to make sure those omegas are optimized, right?
Yeah. Yeah. And what do you like there? I mean, you're just going, I mean, that's an omega-3 index that you run.
Yeah.
That's in basically any lab across the United States. You can get those.
Yeah, and Boston Health had put together a really good panel, and they graph it, and you can get that through your LabCorp or we use a lot of Avexia, but their whole profile is really good. But I like to get the whole of the omegas because they all have, one, they all have their space in our health, but also understanding what those ratios are, your omega
Yeah.
sixes to omega threes, because our our standard American diet is so omega-6 rich and
Yeah.
very omega-3 depleted. So that ratio is almost as important as also just getting a read on your total omegas and omega-3. So yeah, great, easy labs to get.
I'm looking forward to the Dr. Dan course on blood chemistries. When's that coming out?
Oh, pretty soon. I'm actually been working on putting the details. You know how I get like rabbit hole after rabbit hole? I was going to call it the rabbit hole
Yeah.
of blood chemistry.
Yeah.
So still putting some pieces together, but I'm working on a certification course for, like pretty much like just a functional course to understand like the translation of the labs into, a clinically effective, standard to start with. So
I think that is so needed, Dr. Dan, and I really encourage you. In fact, I'm going to give you a pom-pom moment, pom-pom
okay.
moment on that
Nice.
to
Awesome.
do that.
No,
And we'll have you back on when it's ready for prime time. I have a lot of clinicians and providers that do tune in to What the Health. So would love to get that out there. What would you, so, kind of bringing this thing into the station a little bit. So we've been kind of this way and that. What's the take home message for people listening with hormones and brain health, let's say?
yeah. So I'd say first is get a read on where your hormones are. If you don't look, you don't know.
Yeah.
You can't say, I think I got perfect, hormones. When people say I'm healthy, and I'm say, what's your measure of success there then? If
Yeah.
you're healthy. So one, get a measure on it. Two, hormones don't act in an isolated environment. They're reliant upon your big features. So when it comes to those hormones, you want to get them optimized. Two, to get them there, I'd say there's these 5 I's that you want to be looking for.
Mm.
You want to reduce your inflammation, because that's going to make the body use those resources elsewhere. There's a really good study on the endocrine system and the impact of inflammation. And so, one, look at your inflammation. Two, make sure your insulin is where it needs to be. Get your, any imbalances in your nutrients, you want to get those honed in. You want to make sure you don't have any chronic infections, right? And the last is that iron status. So those are the 5 I's. I'd say, look, we see these 5 things impact those hormones, and both directly and via the hormone pathways impact the brain health. So, brain's a part of the rest of the body. And if you want that brain to be optimal, you want those sex hormones to be optimized as well.
Awesome. Awesome. Great take home right there. Any last parting words that you'd like to share?
No, I think one, people need to stay tuned to this podcast, because you're constantly growing and expanding, and you constantly, over the years, we've been friends for a long time, you've challenged me to constantly be a better practitioner. So one, I can't encourage that enough. And then,
well, thank you.
yeah, and then two, once you start down the pathway, just stick with it, and make sure that you don't want to assume success, and you don't want to assume health. So get it measured.
Get it measured. All right, Dr. Dan Kellams, thank you so much. Everybody, if you like today's show, give us a thumbs up. Get out there, give us a 5-star review, and put down a take action moment. Like, what did you learn? What are you going to do? And share that, because that's how the change happens. It's coming right here through that green dot to you in your living room, in your car, wherever you're listening. We wouldn't be doing it without you. So thanks for tuning in, and we'll see you soon.